Have you recently had a total knee replacement and you're wondering how much your knee should be bending? If you have, then this video is perfect for you. Hi everybody, my name is Will Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And today I'm going to be answering the question of how much bend should you have after a total knee replacement. Now, before we dive into the content of the video, if you haven't already, please hit like on the video and subscribe to the channel, because then you'll be the first to hear about our knee replacement videos when they come out. Now that that's been said, let's talk about total knee replacements. Now, total knee replacements are a really common type of surgery that are usually done for people who have been suffering with knee arthritis. So this is the knee model here, and you can see that in a normal world it moves forward and back like this. We've got the thigh bone here, we've got the kneecap, the patella here, and we've got the shin bone or the tibia here. And when someone has arthritis, what's happened is the cartilage that separates the bones has worn down, and then that leads to stiffness and pain and causes a real restriction in activity. Now, total knee replacements are only ever done to reduce the pain in someone's knee. They would never be done to reduce stiffness, because you can't guarantee that your knee is going to be any less stiff after a total knee replacement. And I'll show you why. So when you have a total knee replacement, what typically has happened is the surgeon has opened your knee up, they've taken off the top of the tibia, they've taken off the bottom of the femur, and they may have also replaced the area underneath the kneecap. Now, because now you've got a load of metal work in your knee, sometimes the bend is not quite as good as it was before you had the surgery. And what most people find is they have some degree of stiffness after total knee replacement. Now, that being said, one of the primary goals that I have in my clinic for people with a total knee replacement is to get that knee bending again. And it's why a lot of people, after they've had the surgery, they ask the question, well, how much should it be bending, and am I normal for the stage I'm at? So what I'm going to do is I'm going to run you through what I would consider to be normal or ideal for someone who's had a total knee replacement as to how much they can bend their knee and at what point. Now, it's important to note that everyone is slightly different, but I always have a rough guideline in my own mind for what I want to get someone's knee to after they've had physiotherapy. So what I would first of all start off by saying is that every single person I've met who's had a total knee replacement is very, very stiff in the first 0 to 2 weeks. Now, you might have been told by your surgeon that, oh, don't worry about your knee, we got it to at least 90 degrees in the operating room before I sent you through to recovery. And you might be thinking, well, I can't bend my knee by 90 degrees at all at the moment. So maybe they didn't. Well, the fact of the matter is they would have got your knee to 90 degrees after the surgery, but in the couple of days after your surgery, your body lays down this thick, sticky scar tissue, which makes the knee joint incredibly stiff. And what that's going to do is it's going to severely restrict the movement, so that even though the surgeon did get you to 90 degrees when you were in the operating room, the scar tissue is now going to stop you from bending it that much. So for the first couple of weeks, most people only have about somewhere between 0 and 80 degrees of knee bend. And to give you an idea of what that looks like, if that's 90 degrees, so bending halfway, then 0 to 80 degrees is somewhere around this range here. So that's not really enough to properly do stairs. It's not really enough to get on a bike or anything like that. You need a bit more than that in order to do those things. But if you've got that much stiffness in your knee in the first 2 weeks, that's very normal. Now, at the 2-week point, things start to change. And the reason they start to change is because that is when I would start to see a patient who's had a total knee replacement. We give them 2 weeks to just do their gentle exercises at home and to allow the new joint to settle in, and then physio begins. And one of our primary goals is to get that knee bending a little bit better. So what I would like to see after the first week, maybe 2 weeks of physiotherapy, is for that person's range of motion to have gone beyond 90, ideally to about 100 degrees of bend. Now, 100 degrees knee of knee flexion would take them to about there, okay? So they're bending it just beyond 90, and it should by this point feel comfortable to sit in a chair with the knee just gently bent, and it shouldn't feel like there's a huge amount of pressure around the knee when they do so. Now, if that's not the case for you so far, don't worry, because people do recover at different rates, but that's just the target I have in my mind for someone who's around the 3 to 4 week mark post-surgery or 1 to 2 weeks of treatment. So what I would like to get for someone who's had 90 degrees of bend after about the 3 to 4 week mark is an additional 5 degrees of knee bend every week that passes from there on out. So if they've got 90 degrees at week 3 to 4, then the following week I would like 95, then 100, then 105, then 110. And by the time you start to get to about 110 degrees of knee bend, you can start to do more things. So you're all right on stairs by this point, and 110 degrees tends to be around the right kind of time for someone to be able to get on a bike and start cycling. A good tip for you if you can't cycle the bike forward is to get on a static bike and try and cycle backwards instead. But if you have 110 degrees, there's no reason why you can't use some kind of bike with the seat raised up in order to get a bit more bend in it. Now, when you get to about 110 degrees, the improvement tends to slow down a bit, and it usually drops to a rate of about 3 degrees each week. So for the next few weeks, probably leading up to about week 12, we would look to be moving that knee closer and closer very slowly towards about 120 degrees of bend. Now, 120 degrees of knee flexion, if that's 90, 120 takes it to about there. So it doesn't look like there's a huge difference between those two, but the reality of that is that there's an enormous difference between 90 and 120. With 90 degrees, you can just about do stairs. With 120, you can do them comfortably without pain afterwards for most people. So that's about what I tend to do for people in the first 12 weeks post-treatment. And in my mind, a successful total knee replacement would be bending at least 120 degrees by the time we finish treatment. And ideally, I like to aim for 140 degrees if possible. Now, one of the key ways to see what your kind of potential knee bend is to measure the opposite knee, the one that you haven't had operated on, to see what the movement is there, and then have that as a benchmark to aim for with your other knee. Now, most people don't quite get back to 100%, but if you can get to 80 or 90% of what you've got on your good side, then that is a success. So in terms of what you can do to get that knee moving, the best thing you can do is to get treatment from a qualified professional such as myself, someone who's going to help you bend that knee. When you're bending your knee, it's almost like trying to tickle yourself. You just can't get it to a point where it's going to be effective because the body stops you from doing it. So if you have someone who can help you bend it, someone who's trained in doing that, then they can tend to get a few extra degrees every single week than if you're just doing it on your own. But if you are on your own, then good things you can do for most people are to bend the knee, bend and straighten it as much as possible. You can use heat on the knee once the swelling has gone away in order to lubricate it and basically get that movement a little bit more free, because the heat improves flexibility. You can keep walking, you can keep doing stairs. These are the things that are very important and will maintain that range of motion once you've got it. And other than that, make sure you're regularly checking in with the hospital. Your surgeon will probably want to see you quite soon after the surgery just to check everything's going okay, and follow all the advice you get from the people who are involved in your care. So I hope that answers the question of how much bend should you have after a total knee replacement. If you're at the 3-month, 6-month point and you still only have 90 degrees of knee flexion, don't despair, but do go and seek help because it's likely that something's not quite where it should be at this stage. So if you feel like you're working hard on it and it's just not improving, or maybe you haven't been working that hard on it and you think, oh goodness, I think I need to start working a bit harder, then definitely go and get some advice. So just one quick story for you to finish off before I sign off is I did have a gentleman who had a total knee replacement who came to see me several years ago, and he had had his knee replacement and then his referral for physio had been lost somewhere. So he went 6 weeks without any treatment whatsoever, just resting his knee. Now, when I saw him, he only had 50 degrees of knee flexion, which is almost nothing. And his knee was incredibly stiff. And because he'd left it so long, a lot of scar tissue had formed. So I said to him, the only thing we can do now is do a very intensive block of physiotherapy. Okay, so I was seeing him 3 times a week, every single week for about 8 weeks. And we worked on his knee relentlessly. We were bending it a lot. We were doing soft tissue massage. We were doing everything we could to get it bending. And in the first 4 or 5 weeks, the knee bend came on quite nicely. We were getting about 5 degrees every single week that he was coming in, a few degrees every session, but he was maintaining that bend over time. And then about 5 weeks in, something started to go wrong. So he reported to me that his knee had become very sore and it wasn't really recovering between sessions. What's more, when I was measuring it, it was actually losing range of motion. So we got it up to about 100 degrees and it was starting to go back towards 95, then 90. I couldn't think what was going on. Now, we tried a few different techniques and a few different things and they didn't work. And then in the end, what happened is the gentleman ended up getting a cold and he couldn't come to the clinic for a little while. He missed 2 sessions. And when I saw him on that 3rd time, he said, I'm feeling better, my cold's gone, but my knee's also feeling better. And what we decided was it crossed a threshold where we were actually doing too much on the knee. Where that intensive physio worked really well to begin with, it became so much that after a while it was actually making it worse. So that was an important lesson that I learned. If you're really, really going for it with your knee and you're not seeing results, there's a chance you're doing too much, but there's also a chance if you're not doing that much that you are doing too little. So there's certainly a Goldilocks sweet spot somewhere in the middle that you have to find. Don't do too much, don't do too little, and eventually that bend will come back. So I hope that's been useful. Thank you very much for watching. If you'd like to get more from me, please feel free to pick up a copy of my book. It's called Thriving Beyond 50 and you can find it on Amazon using the link below this video. The other thing you can do if you've been enjoying this videos is leave me a comment below because I love to read your comments and I try to get back to everyone. Anyway, thank you very much for watching. Thank you for your time and I look forward to speaking to you on the next video.